All right, everybody. In June, I had the pleasure of watching some of the first round of procedures performed at Millard Fillmore Gates on MS patients aimed at reducing their symptoms of MS. Now, the doctors principally involved in that study have made time, they got literally out of the operating room to be on our show today to talk about this because we know that you're so interested in this. Dr. Levy and Dr. Siddiqui are both neurologists specializing in intracranial and extracranial vessels techniques, and they're here to talk about this study and to talk about what we now may know. Now, we were waiting 30 days before we actually talk to those patients who had the procedure to see how they're feeling, to see if there's any changes. What do we now know? But it hasn't been 30 days yet. So officially, we haven't hit that mark yet.
Right. And so the phase 1 of the study, as you mentioned before the break, was the safety aspect of the study, to see that we could do this, and we could do this without hurting our patients. And the end point of that study is to make sure the patients are doing okay at 30 days. And at this point, we are not there yet. But I would say that no news is good news, but we don't know till we are across that point.
As tempted as we are to share the data with the viewers, I think, again, to keep the study under the rigors of scientific investigation, to do this right, we're going to follow the protocol, which is a 30-day safety study, which at that point we will share the data in a peer-reviewed scientific manner, and then we'd be happy to come back and share the details with you and your listeners.
Well, it is very promising, isn't it? I mean, you're smiling. It's very exciting for this area because of the high incidences of MS to think that we're actually doing this right here in Buffalo.
The irony is MS treatment actually was pioneered approximately 2 decades ago with Dr. Jacobs and interferon, one of the medications, the mainstay medications for treatment of MS, was actually started right here in Buffalo approximately 2 decades ago. So it's sort of a wonderful irony that now we're pioneering a minimally invasive surgical treatment that may, and I caution, may help a subset of MS patients.
You know, what occurs to me is that MS, and it's a big if, but if we find that the veins and the blocked veins in the body truly do exacerbate this disease, would we actually change the classification of what MS is from an autoimmune deficiency disease to?
A phenomenal question, Linda. That is the great unknown, because to date our focus has been purely on the autoimmune aspect of this disease, the neuroinflammation, the plaque formation in the brain, but it has not remained quite clear as to what initiates that process, what perpetuates it. And so if blocked veins, and there's a big if, really are shown to be important as far as the causation is concerned, MS may be considered the first major venous disease of the brain.
The question is the inflammation that you point out a downstream effect of a vascular disease? So maybe this is a continuum, and there's so much that we still have to learn and investigate, and clearly there's some evidence that there may be a causal relationship, but it's imperative on the scientific community to demonstrate conclusively that there is a cause-effect and potential treatment continuum.
All right. Now, let's say we get to 30 days, and of course we will. It's going to be coming up very shortly. There's going to be another phase, a second phase, and that's equally exciting.
Actually, we would consider that to be the even more exciting aspect of this entire study. The first phase, as you mentioned, is the safety aspect. The second phase starts looking at the more important question as to whether there may be some effectiveness in the procedure. And to do that, we would be randomizing patients, meaning by chance they would be either selected to receive the treatment or not receive the treatment. And they would not be aware as to what occurred, whether they actually had opening of the veins or not, and neither the physicians who would be evaluating them for benefit or harm would know whether the treatment occurred or not. So at the end, we would be able to remove the bias, the psychological bias, what is called the sugar pill effect or placebo effect from the results of the study.
In other words, we would know obviously when we did the treatment or not. The patient would undergo the catheter, they'd undergo the procedure, but one group will have the actual balloon pop open the blockage, the other group won't. And then a different set of physicians, a different set of clinicians will evaluate the clinical outcome. So even though we did the procedure, we won't be the ones determining did this patient get better or not.
Absolutely.
And that is going to be one of the first studies in the world, we believe, that is doing a randomized control study looking at the potential benefit of angioplasty for MS patients.
So exciting. We have phone calls, gentlemen. We're going to get right to the calls. We promised we would. So good morning. Let us know who you are.
Oh, yes. My name is Tom.
Yes, Tom.
From Depew.
Okay.
Being I have primary progressive MS, I'm just wondering if there is a cutoff point, because I'm not really eligible for a lot of studies, and I'm just curious if I'm available or I would be eligible for something like this.
And that's, I think, is the big question. We've had a lot of patients call and say, how do I get in on the study?
Sure.
Can they get in, or what do they do?
So thank you, Tom, for your call. Just to be clear, this first phase of study is primarily concentrating on the type of MS which is called relapsing remitting, because it primarily affects the brain. The type that you described, primary progressive, primarily affects the spinal cord. And the same association of blockage of veins has been made for primary progressive as well. But because primary progressive is much less common, it is easier to conduct the study on relapsing remitting patients to associate, to confirm that association. If indeed we are able to prove benefit, we hope very sincerely, because there are a large number of patients with primary progressive disease, that we may be able to address in the very near future in a separate study looking at the spinal cord.
Oh, it looks like there's light at the end of the tunnel then. How wonderful for these folks who have that form. All right, another phone call standing by. We'll squeeze it in. Good morning.
Good morning.
Hi.
I have a question. After you do this surgery, are people conscious?
Okay.
And if they're not conscious, how long sometimes does it take for them to become conscious?
Okay. Yeah, they are conscious.
That's a great question. So this is done under awake conditions. We give some relaxing medication, but it's very important while we do this procedure that the patient's awake and we interact with them to make sure, again, that there's no harm being done. But this is basically can take about an hour. The patient's awake throughout the whole time, just relaxed, and typically they would go home the following day.
So as I say, minimally invasive, that's exactly what they mean. It's minimally invasive. It's not even quite a surgery. It is, but it isn't, so to speak. It's more of a procedure.
It's minimally invasive surgery.
Yeah, there it is. Now, a lot of people want to know if they can get involved. What you really need to do is talk to your own doctor. What we're going to do is put up a phone number that has a recording that talks more about the study. But if you're interested, talk to your doctor, because first of all, your doctor will know if you have the symptomology or the criteria needed for study that then you would move on to the next level and possibly be considered. But here is the number that you'll want for information. Again, it's a recording. You can't leave your name or number on it, but you'll get information. 218-10MS. 218-10MS. You can always call me after the show if you miss it, okay? That's also 218-1067. The doctors will come back. Maybe at some point we can bring a patient back and talk to you how it's going, but we're going to be closely following this because we know out there you have such interest in this. So it's all good news so far, gentlemen. We're going to be counting down those first 30 days. We'll be keeping our fingers crossed for your next phase of this and see how the blind study goes, and hopefully it'll all be thumbs up and we'll have continued good news. So best of luck. Thank goodness you're both in Western New York. We love the fact that we're doing this right here, and let's hope everybody will have some just great news coming right out of here, Western New York, and we'll have some answers for you. All right, we'll take a quick break, thank our doctors, and we'll be right back.